What's up, guys? This is John Nelson, and you are listening to the Starting Block Podcast. Guys, this is a show for complete athletic development. Our objective here is to give you guys the tools to win, whether you're the athlete, the parent, or the coach. Now, if you're new to our show, here's how we break down. We're a little unique, a little different than other shows out there. We have multiple episodes within the show. The first episode you're going to hear from us is going to be our Q&A. That's where myself and my co-host, Chris Scarborough. What's up, Chris?
What's up, guys? Good afternoon.
So that's where my co-host and I will answer the questions you guys submit to us. Guys, you can submit those questions to info@startingblockpodcast.com. We appreciate you submitting them that way rather than DMing us, just so we can keep it organized. Those questions are going to be about training, performance, strength, speed, power, agility, rehab, all that. We'll tackle it in Q&A. The second episode you get from us is our guest interview. That's where we bring our colleagues on from across the country and actually across the pond too. And they're going to share their stories and tools for winning and what they do with their clients, their patients. And that's actually what we have today is a guest interview. We'll bring our guest on here in just a second. And, as I always say, part of the objective with the guest interview is to help connect you with like-minded individuals across the country, people that share the same mission and core values that we share. And we hope you're able to connect with them if you don't live, local where Chris and I are out in Memphis or Birmingham. And then our final episode is going to be that Friday Fire and Fact. That's about 10 to 20 minutes of me just giving you guys some real talk, just some info that I feel you need to hear, whether it's business, motivation, something along those lines. So that is our episode breakdown. We also ask you that you pay your dues, guys. Share the show, please. We do this for free. We do this because we want to connect you guys with people and we want you guys to win. That's ultimately what we are trying to accomplish here, whether you're the athlete, the parent, or the coach. So that's how we break down, share the show. And that is our housekeeping. And I think I got through that in record time because we're a little short on time today, and I want to go ahead and get our guest on. So without further ado, we're pleased to welcome back Zach Michael of Accelerate ACL for part 2. What's up, bro? Welcome back.
Awesome. Thanks.
How's it going, fellas? Good to see you again.
Great.
Good. You too, man. You too.
Thanks
We
for
appreciate you coming on, man. I think, the first time that we did the episode, we were all kind of getting to know each other. And the episode, we got a lot of great feedback. And, hopefully you did too. And I think you kind of opened people's eyes a little bit, as to a different approach to ACL rehab and therapy. So it was good. I'm glad you took the time to follow up. So, one of the first things that I really want to get into today is, in the first episode, we introduced you, you shared who you were. So guys, if you're just now listening to this, I encourage you to go back to episode 1. I think that was probably back in the early 20 episodes or something. Check out Zach from Accelerate ACL. But today being part 2, let's dive right into it, man. And we talked briefly before the show about where we wanted to go. And so why don't we just start with people that are coming to you, ACL recoveries, that are behind schedule? I feel like that's a fairly common thing. What is it that you're seeing in your facility, and how are you attacking that?
Yeah, that's a great question. In terms of behind schedule, I guess that could come at all different stages of the recovery process, right? So whether it's something like early on in the process and they're dealing with range of motion problems and they're not getting the range of motion back, or maybe later on in the process where they're starting to get into back to some return to sport activity and they're finding out that their bodies aren't responding as well as they'd like to the increased load. Or even something like, depending on what kind of therapist you're working with or what your doctor wants to see, looking at things like quad strength symmetry. So, how symmetrical are you from side to side in terms of how much force your quads can generate. So
what do you tend to find is the most
behind schedule thing? Yeah. I'd say the most common, I guess, maybe one of the most common causes or most common things that we see throughout would be the inability to get into full extension, after ACL surgery. So being able to really fully straighten that knee. And that also kind of comes in a few different forms. Early on in the process, the goal is basically for the athlete to be able to sit on a table and straighten their knee and get it as straight as they can and match the other side. And that's often where the box is checked for full extension. An athlete might come and they say, I've got full extension, the knee's perfectly straight, we're good. But what we'll actually see is when we go to load that athlete, further on in the process, yeah, they can straighten that knee sitting on the table, but does their knee want to stay straight when it needs to go into a triple extension or a double extension position with the hip under some serious load? So something even like maybe a single leg calf raise or something like that would be an easy way to assess that early. But even if you carry that on later in the process to something like sprinting or jumping, is the knee willing to fully extend and create and absorb those forces around the joint or not? And when it's not doing that, you can think about that last bit of extension as the last little bit of force absorption that needs to happen around the knee, in any of our really powerful movements. And instead of getting that last little bit of extension, where's that force going to go? In a lot of cases, it's going to go right into the knee and cause those athletes to be behind schedule. So I'd say, throughout the recovery process, that's a common factor that we'll see, whether it be trying to get that full extension right off the bat or later in the process, and when they're really under load and seeing if that knee is really willing to fully extend. That's kind of one of the main contributing factors we'll see.
So along that same line, Zach, so let's take someone that is, let's say they're 3 months post-op versus say someone who's 1 year post-op. Okay.
Yep.
Do you seem to, but they're both behind schedule. Okay. They're both behind schedule for their time frame.
Mm-hmm.
Do you seem to find better success, or maybe it's easier success with that person who's only 3 months post-op than the person who's 1 year? Do you seem to find is it kind of the same as far as catching them up, so to speak? What's your experience?
I wouldn't put them on different time frames as far as catching them up. The 12-monther is probably still going to be further along than the 3-month person. But both behind schedule for the respective time frames, right?
Right.
So I wouldn't put them on different time frames as far as getting caught up to where they should be. There's probably one of two things that we'd be looking at. It would be what we talked about in the last episode would be, how well is that quad activating on the ACL leg compared to the non-ACL leg? Or, we'd go into something like mapping with the Neubie and determine, okay, what's the unique reason that this person is behind schedule that we're kind of finding through the mapping process. And from there, everything kind of follows a very similar time frame once we kind of figure out what's going on. What's really interesting about the work that we do with these devices is that it really depends on the athlete, how hard they're pushing, how consistently they're getting after it. But I wouldn't expect to see one take longer to get up to schedule than the other one.
Yeah. By the way, and shout out to Garrett Salpeter with a new fit, talking about the Neubie. Shout out to you, Garrett. And this kind of goes back to what John and I have talked about in the past as well, and that is how you really can't compare a typical E-stem, not knocking E-stem, but we're not your typical E-stem with the DC device like a Neubie. Mm-hmm. We have no basis for comparison of the two. We want to be very clear here that we're referring to the treatment is being done with a DC device, not like a Russian stem or something. Nothing against those, but it's not that. It's not Russian stem. It's not EMS. It's not TENS. It's a totally different type of device. So I want to be clear about that with our listeners.
Yeah. Now, I want to go back to a statement you just said. For listeners who may not understand this, and I want your take on it. So you made the comment that the quad might not be as active as it should be. Now, I know just from my personal experience, having done this for 12 years now, that I see people relate that to strength. And so they think, oh, just because I can do a leg extension or I can leg press, it's activated. Explain what you really mean there and actually how you measure that, how active the quad truly is.
Yeah, so there'd be a couple ways to measure it, but what we see and look at early on in the process is how responsive it is to the Neubie and the devices that we're using. So what we'll actually see is that when we put the stimulation on both quads, the quad that's been affected by the ACL injury will basically not respond to the current at all. And until we get up to much higher levels of intensity. So that's pretty unique, for us to see, and we will generally will only see it after ACL injuries or after maybe some other catastrophic or major knee surgery. And that's the first way that we're kind of assessing it. And what we'll see over time is that quad will become more and more active, more and more responsive to the current over the first maybe 2 to 6 weeks that we're working just the quadricep spots with our clients. So that would be a really unique lens on it that we can really only see through using technology like the Neubie. And then later in the process, you look at things like limb symmetry index, which does look a lot more like strength. But even an athlete who thinks they're doing very well from a strength perspective will oftentimes show discrepancies on the limb symmetry index. So that would be another way to assess it later on in the process.
Yeah, I think what's interesting about something along that line is we've seen problems with limb symmetry with simple surgeries like scopes, where something just shut that quad down. I mean, something's just shut it down. And surely one of the some of the sensory mechanisms in the joint are having some effect on that quad, but that's one of those interesting things that the knee seems to be particularly susceptible, knee surgery, and people who've had knee surgery seem to be particularly susceptible to quad atrophy, quad weakening, and that sort of thing.
Maybe
At
for
least my experience.
maybe for some new practitioners, and and Garrett, if you're listening to this, like, bro, I'm not stepping on your toes, man. Like, that's we love you, Garrett. So, but like first maybe some less experienced practitioners out there, I guess, at what stage are you starting to really look for that? Because I mean, clearly, especially in the beginning, I mean, we really got to follow, make sure that client safety is always priority number one. But you know what I'm trying to say. Like, we don't want to elicit a massive amount of contraction or something in the beginning because everything's still healing. Where do you tend to like to kind of start to push things just a little bit in conjunction with PT and what doctors are allowing, to where you can really test the responsiveness of the quad?
So typically we'll start pushing things more at the same time that they're starting their PT exercise. So, oftentimes that could be within the first week or two, where we're starting to generate more of a quad contraction. First week or so will be more about just keeping the tissue relaxed and using some of the lower level settings. Maybe a gentle contraction a couple days in, and then kind of building up from there.
Now, as far as in addition to the quad, I mean, do you find that is early on? We're still early in the process.
Yep.
Do you treat another area besides the quads? I mean, do you treat the hamstrings, the gastroc? Do you do any other areas of the body besides the quad?
Not for the first. I kind of always say it's a combination of two things, right? It's the where we're stimulating and then the exercise selection. So even though where we're stimulating might not be the direct muscle groups that, that's a common question we get. Hey, why aren't we working the hamstrings? Why aren't we working the calves? Why aren't we working other areas of the body with the stimulation? We know that priority number one is to get those quadriceps back online and make sure that atrophy process doesn't take place. And if we want to create adaptation as quickly as possible, and with priority number one, then that's where we're going to stay, and we're going to try to create that adaptation and show that adaptation with progress on the Neubie. So, which means increasing intensity levels on the Neubie, increasing the duration of the isometric holds that our athletes are working while stimulating those areas. And the other thing that it allows us to do, I mentioned earlier, the exercise selection. We can start loading other muscle groups like the hamstrings and calves and things like that through the exercise selection. But we can also now look at, okay, how are the quads causing compensation with these other, when we load these other muscle groups too, with the exercise selection. So we don't necessarily look at the Neubie as, hey, we need to do work on these muscles. Let's put the pads on these muscles. It's more along the lines of, if we stimulate these muscles, how's the body compensate as a response to overloading the stimulation of those muscle groups, and how do we have to train the body to override that compensation, basically. So So not necessarily moving the pads around early on. We want to create that adaptation in the quads, with the technology and the exercise selection. But then, we are looking still through the exercise selection to load other muscles at the same time.
Well, it's interesting that you bring that up. And again, I mean, this is something that John and I have discussed on various podcasts in the past. And that is, if I'm going to train the hamstrings, I'm actually going to, or if I want to concentrically train the hamstrings, I'm actually going to put the electrodes on my quads. Okay, we're not referring just to an ACL repair. We're referring to any kind of training with a Neubie or with an ARP or whatever. But the interesting thing is, like you said, I mean, it's like we're not, just because we have that machine on the quads, it doesn't mean that we're just training the quads.
Right.
We're doing a lot more than that. So, but I do want to go into a little bit more on like certain case examples, Zach. I mean, you've had a few interesting cases in the past. I don't know if they were behind schedule or not, but people that were, maybe they were behind schedule or maybe just somehow. Anyway, give us. You were telling me a couple of things before we even got on the air. What are some of the interesting cases that you've seen in people that you've had as clients and that sort of thing?
Sure. Yeah, I mean, kind of within the framework of being able to take somebody from, we're looking always at our data and some things, average ACL recoveries and where clients fall against the average based on, we look at a lot of something called the left score to measure our clients' progress. And what we'll generally see is that if they're starting behind the curve or under the curve for where the average ACL recovery is, we can bring them up and above the average ACL recovery within the first month of work. So it's pretty cool. We chart it all out. We've got our average ACL recovery line here. Maybe our client is falling down here at some point when we first start with them. And basically within the first month, we're going to have them on top of that curve so that they're now ahead of the average ACL recovery. Now, as far as specific cases go, we talked a little bit before the show about one of our clients, Saquon Barkley for the Giants. He came to us, I'm going to say about 4 or 5 months into the ACL recovery process. Primary goal was to be back and ready to go for week 1 of the following season, and had just seen his doctor, one of the guys who does tons of surgeries for these elite athletes out there. And he has an assessment that he uses that was on a 50-point scale, to kind of assess where his patients are at. And when he came to us, he had just seen him for the first time for this assessment and was deemed to be, pretty far behind schedule. Then he was actually, it's interesting, kind of ties into your previous question there about pad placements and things like that. He had been using the Neubie for a few weeks, but not really maybe within the framework of our protocols. And they were putting it in areas where they just kind of thought needed the work based off their eyeballing it, looking at the muscle and saying, okay, the muscle's not as big here. Let's put the pads here and do some work. And they weren't really getting a great result at the time. So we took them through, our protocols, which at that stage is probably going to start with some mapping. And he was within 7 weeks of that first assessment with the doctor. He was in the 95th percentile of all ACL recoveries the doctor had ever seen. So he went from pretty the first assessment not being so great all the way up to the 95th percentile 7 weeks later by doing some work within the framework of our protocols. So that kind of speaks to that behind schedule, depending on who you talk to, whether the athlete's behind schedule or not, but maybe not coming along as quickly as they'd like. And within just 7 weeks of time, and I'd say even shorter, oftentimes our clients are able to really get on top of that curve that I alluded to earlier and make sure their recovery gets back on track. Well,
as a Giants fan, I'll tell you, thank you for all your work on getting Saquon healthy. I greatly appreciate that.
I didn't know that.
Let's keep talking about a few other case examples there. What are some other success stories that you've had that, maybe were pretty challenging. Like maybe, we go back to like a range of motion thing, or, maybe a second tear, and just, I don't know. I just want to hear maybe more of like some high school or more relatable scenarios. Because I think some people, as much as I love talking about Saquon, I could talk about Saquon all day. Like, what about the average high school athlete though, that tears his ACL and doesn't have access to,
Yeah.
unlimited, therapy and equipment?
Right. Yeah. Yeah, I think that a couple that come to mind, maybe some college, athletes that we worked with in the past, find us around the 5 month mark, 6 month mark. They really want to be back to running at that point. They're athletes through and through, and haven't been able to do a whole lot athletically for the previous 6 to 8 months, and they're not really getting clearance maybe from their training staff, or they're still having significant levels of pain despite having clearance from their training staff. We'll find a lot of athletes in those situations. And, same kind of principles, that we talked about, and, to the question earlier, where it's 3 months or 12 months, we're not going to do too much differently from a protocol, perspective, as far as exercise selection goes, and getting into some mapping and things like that. But what we'll generally see is that whatever that obstacle is, or that hurdle is, that the athlete's dealing with at that stage, whether it be pain in the knee or mechanics, or maybe it's they don't have the quad strength symmetry that their training staff's looking for, we're really able to help them push that timeline and make sure that they're able to get to where they want to be. I often will tell clients about 1 to 2 months of work is what we would expect to need to get them where they want to be at that point.
So you made
You know
the
what I think
comment
is
there about
is
pushing
so
through some pain levels right there. So let's dig into that too. Like, we talked about applying, pain science principles during a return, and how a lot of these people are pushing through, pain at 4, 5, 6 level. Like, speak on that a little more.
Yeah, absolutely. I think that's especially when you get into these college athletes, high school athletes, where if you ask them to jump, they'll say how high. They'll do anything you ask them to do, and pain is really not even something that obstructs them from doing anything. They'll just push right through it and be able to get after it. We'll see a lot that let's say they get back to running, they get back to jumping, and they're going to just go right through the pain, and maybe they won't even communicate too well about how much pain they're feeling. You might have to dig in a little more on them. But what we see is that if they're pushing through higher levels of pain, you mentioned the 4, 5, 6 out of 10 levels, that can kind of start a whole cascade of events that's going to just keep them stuck or delay their recovery further. Pain is something in the brain that is telling us that it thinks there's a threat there. And when the brain thinks there's a threat, it has, I guess, 2 decisions it can make. It's analyzing that threat, and it's saying, is this threat worth me shutting things down further, so that we don't have any more of this pain, or we don't have any more of this threat. I need to tell the athlete, stop doing this, so I need to shut things down further with additional pain, or maybe start deactivating some muscles. Or is this a threat that I'm kind of so about, and I haven't yet determined whether or not it's something significant, but as it sees it more and more reps of it, the pain actually starts to drop off and maybe go down to lower levels. So in terms of what we'll see with a lot of these athletes that'll kind of push through high levels of pain, it's that first option that the brain is seeing and saying, hey, this is a serious threat here. We're going to elevate pain levels because you keep pushing through this level of pain to try to get you to stop. We're actually going to start deactivating muscles again, which in ACL world, we're doing so much work to, get that quad back online. We're doing so much work to get that full extension. But pushing through that pain is kind of taking us steps backwards at times, and causing the body to want to compensate even more. So, we'll guide our athletes at that stage, low levels of pain, 1s, 2s, 3s, generally pretty good and productive to be able to work through and kind of explore further. when those pain levels go above, that level to fours, fives, sixes, seven, eight, nine, tens, that's probably a good sign that wherever we're at for today, it's it's a good time to kind of document how much work we were able to get in, so we can say, yeah, the body's comfortable doing this much, and maybe shut things down and look to build on it the next step. Um, so in doing so, we're kind of working with the brain, with the body, to say, hey, we understand that this is starting to feel more threatening today. Next time we come back, we're going to have a little bit better ability to do this activity and kind of see if we can do more of it before those pain levels start to elevate.
So when you're referring to pain levels, you're referring to like knee pain, not intensity on the machine, correct? Or are you a little bit both?
Yeah, this would be these pain levels would be more testing off the device. So once we get off the device, or maybe they're not even working with us, maybe they're working with, we don't, their athletic training staff or something like that, or their coaches. This would be knee pain that's associated with work they're doing off the device. We do always try to differentiate between, we'll even say discomfort on the device and pain as being something separate. Because of course we are encouraging athletes to push to high intensities and high levels of discomfort on the device. That is not the same type of pain as their knee symptoms.
Right. Yeah.
Why do you feel that it is that so many of these athletes, or even just, weekend warriors, get to a point where they're, 5 months post-op or something and are still experiencing these types of pain levels? Because I feel like that's one of the most common things that I tend to see personally, is maybe not a lack of range of motion, but still above a 3 pain level. Why do you think that happens?
I think it can happen for a number of reasons. I think, if we're alluding to athletes, weekend warriors, people who are used to really pushing themselves, right? Maybe they haven't been listening to that pain throughout, right? So, I like to think of it on a spectrum where we're kind of bringing the body along on a spectrum smartly, by listening to those low levels of pain, stopping when we go above, and building our ability to do more and more of the activity at those low levels of pain. But maybe in the case of somebody who's used to pushing, we're seeing that they're just constantly pushing into those 5, 6 levels of pain over and over and over and over again. So they're not really. I think the general school of thought out there, even that we run into sometimes, with athletes that are getting guidance from elsewhere too, is that if you just keep pushing through the pain, it'll eventually go away. You just need your body to be exposed to it more. That's true again for those lower levels of pain, but it becomes those unproductive levels of pain, those 5s and 6. If maybe to your point about 5 months, maybe they've been doing it since month 1. Maybe they've been working on their range of motion, and the message has been like, who cares how much pain you have? You need to get through that range of motion, which can be a school of thought, especially early on in the process. But if that carries through the entire time, then you're never really allowing the body to adapt, and you're never really creating the change and the perception for the brain that it's a lesser threatening activity to do.
By the way, while we're here, I want to share a story very quickly. Who I got permission from one of my clients, Zach, after I consulted with you, who's a kid who college football player, had just had ACL and meniscus surgery. So he was non-weight bearing for 3 weeks post surgery. He sought to go be non-weight bearing. All he had to compare himself with was a friend of his that had ACL reconstruction, did not have meniscus surgery. Well, within a month, 1 month post-op. Now, keep in mind, the first 3 weeks of this, he's non-weight bearing.
Mm-hmm.
She was weight bearing. She was weight bearing as tolerated almost from the get-go. 1 month after his surgery, he had already surpassed her range of motion levels, her strength levels, if you will. I used exactly the protocol that you told me to go with, and literally he's now 8 weeks post-op. Okay, 8 weeks post-op. He walked in last week he only comes in once a week now to get a treatment. He walked in last week. There's no noticeable limp. He's out of the brace. He's out of everything. The only time you would even know he had any kind of surgery whatsoever was when he started walking downhill. You noticed a little bit of a limp, if you will, but it was not. I mean, it was pretty much unperceivable when he was walking on level ground. No brace, no nothing. 8 weeks post-op. So I want to, I want to give you a shout out for the protocols that Accelerate ACL uses. They work. Now, granted, I have an N of one, right? I have one person to go by,
Sure.
but that's pretty good. I mean, let's face it. 3 weeks of that, he was non-weight bearing.
Yeah. I appreciate you sharing the story, and yeah, N equals 1 for you, N equals many on our side of things, and I think there's a lot of maybe other practitioners out there too of really good success stories, and that non-weight bearing phase can be a real difficult time in terms of getting out of that for an athlete. So the fact that he's able to respond so quickly is great, and speaks to the work that I'm sure he was pushing himself pretty hard to drive those results, and you were pushing him at the same time. So awesome work there.
Yeah, he did a great job. And John got a similar story.
Yeah, that's that 3 weeks non-weight bearing. I have a kid I'm working with right now. Same thing, ACL and meniscus, and basically after his first session with any type of active current, we're able to actually do a straight leg lift, no brace, and happened within 15 minutes. So it was pretty cool to see that. So he's
that's always a fun magic trick.
Yeah, I know it's like a magic trick. But let's all right. So we've been talking about success stories, man, and it's awesome. And ultimately, that's our goal is to help people win. Let's talk about though maybe a scenario or two where we've hit some roadblocks. All right. I can think of one example. I have a client, actually. He is a collegiate lacrosse player, a very high level collegiate lacrosse player. He's actually had 2 ACLs and a meniscus. And the kid actually has a Neubie himself. I believe only half of the meniscus is still there. I can't remember the exactly how much, but not all of it's there. And this kid can take the Neubie all the way up. No trouble whatsoever. 100 every time. Still has pain. And, he's looked at by team doctors, our local providers, a number of people, and there's a lot of different theories. But one of the interesting things that I tend to see with this individual is his hamstring is always a hot spot. Always. And it will not go away. Thoughts on that?
Mm-hmm. And he's maxing it out at, so even though he's consistently hitting 100 on the hamstring there, it's being maxed out.
I don't know if he's gotten to 100 on the hamstring. I think he has, but I know he can get to 100 on many other places.
Yeah, right. So he can push, and he's working hard at it. I guess that would be my first question, right? Is how much is he getting to 100 on that spot? If he is, how long has he been working there? Generally, let's say within week 1, if he's somebody who can push, he's getting to 100 with a pattern that is maybe in a supported or assisted squat or something along those lines. And then we hope that he's spending maybe 2 to 3 weeks hanging out at 100 doing ISO work, for 5 minutes at a time in various different positions. So if he was doing something, if he did a month of work like that and still had a hot spot on his hamstring, I think I'd be pretty surprised. Yeah. Now, if he's not able to get to 100 and it's like every single day he's coming out and he's getting to 60 and he just can't get through it, I guess questions I would have is, is there questions I start asking myself in those situations is there a compensation that I'm just not seeing, or like something that because when they keep hitting intensities and they run into these roadblocks, that's an indication that whatever adaptation needs to happen to be able to get past that intensity, that adaptation isn't occurring, and we'd expect it to happen within the given session. So that's maybe I'm looking at something like an athlete that keeps hitting 60 over and over again, and even when they work at 60, the intensity never drops down as they do more reps of it, which it should be dropping down as they do more reps, because that's, we're creating that adaptation. Then I need to start asking myself, is there something going on there that is I'm not seeing, whether it's just because I don't have a good enough eye, or it actually is imperceptible. And maybe I'll start asking a lot more questions about what they're feeling, how that pad is inhibiting them from doing the movement correctly. What they're feeling there is how it's trying to inhibit them, to help figure out, is there compensation happening there that we can break through and help to get even higher on the intensities. Other ones I would ask, if they're not getting that high, able to break through, would just be things like optimizing all the factors outside of the Neubie work and outside of the recovery process. So, are they fueling properly with good protein and water? Are they getting good sleep? Because that can cause day-to-day variability and how much intensity somebody can work to. So those would be, first thoughts that come to mind there. Again, if he's maxing out at 100 and just crushing it, and that hamstring's still a spot, then I'd probably, have more questions and want to sit on it a little longer and think.
Yeah, I know that's a tough one to put on the spot for you right there. But it kind of led to the second part of the question, and I set it up that way intentionally because we've been talking a lot about the quad, right? And its importance, but the hamstring, for example, keeps popping up. And have you seen anything like that? And how big of a role, I guess, do you see that posterior chain being in this type of recovery process?
For sure, yeah, the posterior chain's huge. It's a lot. We've got a lot of the force absorbers, right, or the force creators, and things like the quad. When we talk about the knee joint going into extension, posterior chain needs to be able to work to absorb those forces going into that fully extended, powerful position. So when we do our work, to speak a little more even generally, we'll focus on the quads maybe for the first 1 to 2 months of work, and that's where the stimulation will go. From there, we're going to go into mapping, and we're going to determine, where those hot spots are and start working those. So that's kind of the beauty of the mapping, is it'll tell us where that work needs to be done and where the most efficient work can be done with the Neubie. And if it's on the hamstring, then that's definitely a good indication for us that posterior chain needs some more work.
By the way, I didn't. Yeah, I know we're not trying to give Garrett a big head or anything like that on today's podcast. But let's face it, you have to have a device like a Neubie in order to be able to do what you've used the word mapping on a few different times, and we've also used the term hotspot a couple of different times.
Yep.
You map to try to find a hot spot. That's the spot that's the muscle or the area that's not absorbing forces properly. And about the only way that we're aware of that you can truly find that spot is to use a device like the Neubie. So, like I said, we're not trying to give Garrett a big head here, but that's what the beauty of these devices are, in that, you can find where is the problem, the very specific problem. So anyway, Zach, I just wanted to go, so our audience is not confused. What does that mean, mapping? What is that? What is that? So I have some idea of what we're talking about.
Yep. Yeah. Thanks for adding that in there.
So
wrap up with one or two things that like I said, we've already had episode 1, so episode 2 here, so let's kind of keep that theme there. Like, when you have somebody, coming to you, who's a little bit behind schedule, if you give them one piece of advice, what would you say to them?
I think probably 2 of the main themes of what we talked about today were, be smart about pain levels that you're working into, especially as you're starting your return to sport activities. And I'm not somebody who says don't push into any pain. It's just being smart about what's productive pain and unproductive pain. So Again, ones, twos, threes, generally going to be pretty good to work through. Anything above that, probably just a good indication that whatever you're doing needs to be modified for right now so that you can get better and better at it, or just, needs to be stepped down on intensity level for right now until, the body kind of adapts to a lower intensity of it. And then the second thing would be, just keep on drilling over and over again for your body, loading and full extension, full knee extension. So, it's not something that I see as something that an ACL, athlete ever really should move on from. They need to keep on showing their body the fully extended position and loading in it. So whether that be, through really focused isometric work, maybe in like a single leg calf raise, or something along those lines, you just need to keep on exposing your body to it, making sure you have access to it so that your brain doesn't lose that thought process of what it feels like and what it needs to be able to get.
Good advice, man. Good advice as always. All right. Reminder, where can everybody find you?
Can find us online at accelerateacl.com or our Instagram, accelerate_ACL.
Awesome. Bro, it's been great to catch up with you again. I appreciate you taking the time to come out and join us again, and maybe we'll do part 3 again down the road, man.
Absolutely. Yep. It's always great getting together with you guys. Appreciate it.
All right.
Thanks
That's
again,
the show,
Zach.
guys.
Yep. Thank
Share
you.
the show, guys. Thank you.